Good afternoon, everyone. I have 1 o'clock, so we're going to go ahead and get started. I am Casey McGee, the Quality Improvement Coordinator with Network 8, and I want to thank all of you for joining us today on the Explore Transplant and Living Donor webinar. Also with me on the call is Sheila McMaster, who is the Network 8 QI Director, and Natasha Avery, our Executive Director. And then last but certainly not least, our speaker for today, Christina Goalby, who is the Manager of Transplant Initiatives for Health Literacy Media. Before we move into the presentation today, I'm just going to start off with a few webinar reminders. Christina, could you switch to the next slide, please? We do have everyone muted on entry to the call today, and everyone will remain muted throughout the presentation. We do this just to minimize any background noise, but we do, however, encourage those of you who have joined the webinar on your computer to submit any questions or comments that you might have in the chat feature. When you do this, just please sure that you send them to all panelists. There's a little drop down that you can select. We have more than one person who's going to be monitoring the chat, so please make sure that you do send your questions to all panelists. And we will have a question and answer session after each segment of the webinar today, where we'll address any questions that have been submitted through the chat feature. And then finally, after the presentation, next slide please, Christina. After the presentation, please make sure that you call your network to provide your name and mailing address so that we can mail you a packet of the educational materials that go along with this program. This is really important for those of you who are dialing in over the phone only. We do have the mailing address, or we should have the mailing address and that information for everybody who is attending on their computer. But I do know that we do have some patients who are planning to dial in over the phone. And I know that you can't see the phone numbers that are listed, so grab a pen or a pencil real quick. And if you're a patient from Alabama, Mississippi, or Tennessee, you're going to want to call Network 8 at 877-936-9260. Again, that was 877-936-9260. If you're a patient from Texas, you're going to want to call Network 14, and their number is 877-886-4435. That was 877-886-4435. And so now I'm going to go ahead and introduce our speaker for today. As I mentioned earlier, Christina Goalby is the Manager of Transplant Initiatives for the Health Literacy Media, and she has been a nephrology social worker since 1996. She is co-creator of the Explore Transplant Dialysis Provider Training and has used Explore Transplant directly with over 300 patients. Christina has taught over 100 Explore Transplant professional trainings. She served as a consultant for Dr. Waterman's research lab at UCLA and Washington University in St. Louis. She was previously Divisional Lead Social Worker at DaVita and past co-chair of the Council of Nephrology Social Workers of Eastern Missouri and Metro East. So welcome, Christina, and I will go ahead and turn it over to you.
Fantastic. I want to make sure everyone can hear me okay. Am I coming across okay on that end?
Yes, we can hear you loud and clear.
Great. Okay. Just a little bit more about what I do, and thank you very much to Network 8 for putting this together, especially Natasha and Casey. We've been working on this for quite some time now, and it was supposed to be a live training, but given the current climate of everything, we have been able to adapt it into a virtual setting, which we're really fortunate to have that option. With that, just a little bit more about where I work. I work at a nonprofit in St. Louis, so I'm coming to you live from St. Louis, Missouri. Health Literacy Media is a health communications nonprofit that helps make daily communication about various health aspects more clear, meeting all the various principles of health literacy. I oversee the specific work as it relates to kidney transplant and living donation, and we will be covering a lot of that today. A little bit more of a unique piece compared to what health literacy typically does. I transitioned to health literacy media about three and a half, 4 years ago, and as previously introduced, I put on educational training seminars for healthcare professionals, patients, of course, their loved ones and social supports, and in various capacities about transplant and living donation. So with that, I will move on. Some of our goals for today, let's see here, excuse me. Really what we want to do is enhance your knowledge about kidney transplant and living donation. I don't assume that you know a whole lot, and I also can't assume that you know nothing. So we have on this call today a mixed audience. This particular presentation was built for individuals that have end-stage renal disease and their social support and loved ones, perhaps potential folks that are thinking about being a living donor, or maybe just generally are interested in learning more about transplant and living donation. But I also know that we also have healthcare professionals on this call as well, so which is really exciting. That's telling me that you want to do right by your patients, learn more about treatment options, and maybe be a little bit more informed when you're sitting chairside with your patients and talking to them about transplant and living donation. So I welcome you all today. We're going to review the Explore Transplant Education program at length, of which you will receive copies of our program afterwards, compliments of the network. So we will be examining the various components of the education itself, as well as viewing some of the videos that accompany this education program. It's a very heavily video-based education program, and we'll talk more about that as those components are being introduced. At the end of this call, towards the end, the idea is also then to help you plan, make a plan for transplant if that is your wish. We can strategize about what that looks like for you. It's going to be different for everyone. This program doesn't assume that you want a transplant, doesn't assume that you're going to get a transplant. This program really is about making sure that you have all of the information to make an informed treatment choice that is right for you. So, and that is your choice, that's your family's decision. However you come to a conclusion about what treatment option is best, this program is really to support that direction, whether that is going forward to getting a transplant, whether that is going forward to getting a living donor transplant, or even staying on dialysis. We want to make sure that you have the information to make that right decision that's best for you. And as mentioned, we will be sending you copies of the education following this webinar. Just a quick agenda. We're going to first start with introducing you to some basics about kidney disease, and then we'll be going into more in depth about transplant. Again, these are all components of the Explore Transplant Education program, and we're going to be going into living donation, and again, at the end of the day, helping you think about a plan that's right for you. Just a little bit of groundwork. I'm sure most of you on this call already know what your treatment options are, but typically that is twofold. When kidneys no longer work, called end-stage renal disease at stage 5. Now it's being coined as end-stage kidney disease, so you might hear it both ways. They mean the same thing. There's two treatment options: dialysis, which most of us on this call are very familiar with, where it's a machine that's helping you clean your blood, or there's the option of transplant, and of course that's what we're here to talk about today. Transplant is when an individual whose kidneys no longer work receive a kidney from someone who has passed away, called deceased donor transplant, or from a living donor. And again, we'll get more in depth about the options of living donation as well. So just to define deceased donor transplants, again, a surgeon puts in a kidney from someone who has recently passed away, from someone who's compatible, and we'll talk a little bit more about compatibility later. Deceased donors function for at least 10 to 15 years on average. There's caveats to that, but for the most part, that is what we're seeing. Living donor kidney transplants last a little bit longer, usually 15 to 20 years, and they can be directed or non-directed. Directed means you get a kidney from someone you know, and that kidney was intended from you, so that living donor decides to donate his or her kidney to you, and that's a direct donor kidney. The indirect is when we used to refer to as altruistic donor. Now we call it a non-direct donor. And that would be someone in the general public who just wants to do a good Samaritan, if you will, and they then donate their kidney to someone they may never meet, never knew, and again, called non-directed. And we're also going to get into the idea of kidney pair donation. That is really something that's becoming a lot more mainstream and popular and growing a lot these days. And so I want to talk more about that as we get into the options of living donation. So we're going to do a little Q&A, and Casey's going to help me with this, but this is just to make it a little bit more interactive and a little bit more interesting so you're not listening to me talk the whole time. So Casey, if you want to tee it up for me, because I can't see the chat box, so she's going to coach me through this.
Sure. We're going to have a few of these questions for you all today. So those of you who are using your computer as we go through these questions, we just ask that you type your answer in the chat feature. And again, just be sure to send that to all panelists. So our first question today is, what % of the work of one functioning kidney does dialysis do? Is it A, 10 to 15%, B, 25 to 30%, C, 50 to 55%, or is it D, 75 to 80%? And we're going to give you just a minute to type your answers in the chat feature, and then we will find out what the correct answer is. It looks like so far we've got 1A, 1C, and 1B. I'll give y'all just a few more seconds to enter your answers, and then we'll find out which one's correct.
And zero judgment, by the way. So if you don't know, that's okay. That's why we're all here.
All right, it looks like we've got 2 people who said A, a couple said C, and then we had 1B. Do you want to go ahead and reveal the correct answer?
Okay. So it's 10 to 15%, and I don't know if that actually shocks anyone on this call. And this isn't to knock dialysis by any means, and I want to be clear about that. As we talk about dialysis versus transplant, and even deceased versus living donor, I'm not saying that one is better for you than another. This is really to get you thinking about what the different treatment options look like and how they kind of stack up next to each other, the pros and cons of each treatment modality, so that way you know you're really looking at the bigger picture. So 10 to 15% is what dialysis does. And let's talk about the benefits of transplant compared to being on dialysis. Patients, obviously, or individuals who do get transplanted will feel better, assuming that that kidney is working, and we'll get into risks and benefits of that. But assuming that the kidney is working once it's placed, that kidney can replace normal kidney function from up to 50 to 80%, which is quite an increase over dialysis, as we just saw. And also, individuals who receive a kidney obviously would have more freedom to travel, perhaps go back to work, do some of the things that they have enjoyed doing prior to when their renal disease got to the point where they required dialysis. Now, I'm a huge advocate for folks on dialysis to be able to travel and to have as much freedom as humanly possible. As a dialysis social worker for many years, a lot of what I did was help patients do just that and be as independent as possible. So I'm not going to say that that's not possible on dialysis, but you can imagine that not having to be tethered to any type of machine to maintain, your health is obviously going to no longer be an issue when you get a transplant. And we've also seen and know that folks that are able to get a transplant have less anxiety and depression, and that makes sense. Living donor transplants rate their quality of life as actually being higher than folks who received deceased donor transplants, and there's many reasons for that as well that we'll go into. Again, this next slide isn't to say anything negative about dialysis. This is just the reality of how hard dialysis really is on people and how it does affect quality of life when you stack it up against other treatment modalities such as transplant and living donation. So if you take you look at yourself on this chart, we know that on average, a person with, between the ages of 45 and 49, on average on dialysis, life expectancy is about 9 years. Now that is an average. That it could be more or less. And again, we're just looking at on averages. And we all know people that have been on dialysis for many, 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 many years, and they've thrived. And that's fantastic. But we also know what happens to people on dialysis over time. It really takes a toll on the body. And that's what these next few slides are really telling us. That life expectancy on average, as you can see, based on these age groups, will increase over time within the next several years if that same person were to go forward to get a transplant. And you can see the number of years gained. So anyway, it's just to let you know that the outcomes of getting a transplant are very, very good. And we also know, and look at the 5-year life expectancy, again, just another reminder about how hard dialysis is on our bodies. In 5 years, you can see what happens to a life expectancy, that only 42% of patients are still with us compared to what happens when folks go forward and get a deceased donor transplant. And even more so for the living donor transplant, you can see in the 5-year life expectancy that their life expectancy basically doubles. So let's talk about those benefits of transplant. We know that within the first year, 90% of those kidneys are still working. So there's a 90% chance that you get a kidney transplant, and within the first year, it's still going to be working well. Now, these are national averages. If you look at individual transplant centers, some of those averages are much higher, and their outcomes are much greater. And there's information out there where you can take a look at these individual transplant centers to see where, in fact, those centers are having better outcomes and that their kidneys are lasting longer. That's all public information. So, but we have to talk averages here. So within that first year, 90%, that's 9 out of 10 kidneys are working within the first year. And over the course of 5 years, 80% of those kidneys are still working. So we know that those outcomes are very, very good. We also know that individuals that have that do go on dialysis do better if they were to get a kidney prior. If they are fortunate to get a kidney prior to dialysis, that's the best outcome. I'm guessing most people on this call are already perhaps started dialysis, so I would encourage you to consider going forward for transplant if you're at all interested. Within the first 2 years of starting dialysis, you have better outcomes. Now, that's not to say if you've been on dialysis 5, 6 years, you shouldn't go forward. Absolutely, you should go forward. But if you happen to be in the earlier stages of starting dialysis, your outcomes are usually much, much better than should you wait over the course of time being on dialysis. And we also know, compared to deceased donor transplants, patients with living donor transplants have better physical overall functioning, and psychosocially, their social life is better. I want to introduce a little bit more about the organ allocation policy. This is how kidneys are actually given out. And I'm only going to gloss over this a little bit because it is a change from in the past. This came out December 2014. And I want to acknowledge the old way that kidney transplants, the way it used to work, is that it started when you were approved for a transplant. After you went through the evaluation process, then your time started ticking. Now, the wait time, if you're interested in getting a transplant, you go through evaluation and you get listed. Your wait time starts the day you started outpatient dialysis, and that's really important. So if you've been on dialysis for 5 years, for example, and you go forward and are approved for transplant and are listed for a kidney transplant, your wait time started 5 years ago, and that's a huge improvement than how it was back in the day when just not that long ago. So that benefit now exists where it didn't before. And also they're now matching younger kidneys with younger people. And that is to increase the overall life expectancy of that graft, of that kidney itself. So these new allocation policies are really trying to maximize the available organs that are out there, minimize any discard or any reasons why the kidney would not be utilized. It's also helping with patients or individuals that are harder to match. Whereas before, someone could be waiting many, many, many years because of they were a difficult match, meaning that the blood types didn't work, and from the deceased donor wait list, they didn't have a living donor, and those folks, unfortunately, would be waiting for a really long time. But now, those folks are not being prioritized on the wait list if they're harder to match. And again, this is a result of the organ allocation system that came about just a few years ago. So we can talk more offline about that if you're interested, but certainly the transplant centers are the experts when it comes to waitlisting and what that means for you. Change it up a little bit, and I'm going to queue up Casey again for another Do You Know?
All right. Our next question is, what percent of transplanted kidneys function for at least 1 year? Is it A, 50%, B, 75%, or C, 90%? And again, you can enter your answers into the chat feature. Looks like we have one C so far, another C. Everybody's saying C.
All right, that means they're paying attention because we covered it earlier. So yes, and that's great. That was just a little test to make sure everybody's following me. So yes, we know that those outcomes are much higher. And as I mentioned before, some of the transplant centers have much higher outcomes than these national averages. So just something to pay attention to. So just a little bit more information about that wait list and what we're seeing over time with the wait list and why. And the importance of deceased and living donation versus staying on the wait list. The wait list is going to continue to go up. There's a small downtick here, but not by much. And you can see what's been happening over time. And that increase will continue as we see patients, more and more patients, and even younger patients develop renal disease. That list is going to continue to increase, unfortunately. Then you take a look at what's happening of the number of patients that are getting deceased donor transplants, which is orange. Now, there is a slight uptick here. You can see that there's been an increase over the last several years, and there's probably a lot of reasons why. The biggest thing I can tell you is that, unfortunately, there's the opioid crisis that's going on, and there's been an increase of deceased donor transplants as a result of that. But by and large, there's still a huge gap here of the wait list. And we'll talk about the wait list and how that wait list could affect your health waiting on the wait list over time. But look what's happening with living donor transplants. Unfortunately, living donor transplants are very stagnant, and which is really unfortunate, because if we're going to close this gap at all, to be able to increase your chances of getting a kidney transplant are going to be much greater if you would consider living donor transplants versus waiting on the wait list. And we'll talk about why that is so next. Do we have any questions so far? Go ahead and use your chat box if we do.
Hey, Sheila, have we had any questions come into chat yet?
Okay. None yet.
Okay.
Okay.
And great. Thank you. I just want to encourage our attendees to, if you think of a question, feel free to throw it out in that chat box. Sheila is managing those questions, and we've built in throughout the slide deck opportunities to answer those questions, and also opportunities for you to ask them if you think of something when those certain slides come up. So feel free to throw those questions out there. Okay, so let's dive into the actual Explore Transplant Education program. Again, this is a program that has both print and video components, and that you will be receiving copies of this after the conclusion of this webinar. We'll be mailing those to your house if you choose to receive those copies. The first component I want to introduce to you is the basics of kidney disease. These are all the components right now. The one that we are going to be referring to is the basics, and we'll take a deeper dive into this after we watch the video that corresponds with each of these various components. So let me introduce the first video. This isn't the full video. This video is about 15 minutes long, and it's giving you just sort of a snippet of what the full video looks like. So I do encourage you to take some time after this webinar when you do receive copies to watch the videos in their entirety. They're about 20 minutes each, and there's 4 of them, but we will go through just more of a shorter version of each so you can get a taste for what those videos are like. So with that, we'll go ahead with the first one. Bear with me while I do a couple. Oh, I gotta download them all again. Hold on real quick. Okay, here we go. Okay. All right. Can you see me? Am I back?
Yeah, we can see you.
Thank you. Okay, just a little few transitions there. So as we saw in the video, this program is very heavily video-based, and it goes hand in hand with the educational components that we will be looking at right now more in depth. So Amy and Dr. Nicholas introduced the idea of this first brochure called Basics of Kidney Disease. And this brochure, what we really like about it is it's newer to the education program in itself, because we wanted to make sure that it included information about kidney disease in general, so that if someone hasn't started dialysis yet, this is a really good resource that introduces what kidney disease is. This is a good resource to introduce treatment options to other people who don't know much about kidney disease, such as family members and friends. And again, these are just snapshots of some of the content of what you're going to receive. The basics of what kidneys do, what is kidney disease, what are the common causes of kidney disease, ways to slow down the progression of kidney disease. And then also goes into the treatment options that are introduced. And what I like as part of this brochure is it starts you thinking about why kidney patients get transplants. It talks about the pros to getting a transplant. And oftentimes we don't think about what is possible should you get a transplant, what is missing in your life, and if you get a transplant, could that then be possible? And then it also goes into why donors donate. What are the pros to individuals donating a kidney to you? And this is very much what motivates others to consider being a living donor. And you'll see a lot more of those stories in the videos themselves. So with that, I'm going to move on and see if we have any questions that have come up.
No questions at this point.
No, okay. So I'll tell you, we're 5 minutes ahead of schedule, which is good. Let's go ahead and take a 15-minute break. We have, and we'll go ahead and give you a countdown on when that break is over. So I've got, let's see, we're at 1:38 right now. So Casey, what do you think, about 10 till? 5? What do you think, 5 till?
Yeah, let's shoot for 10 till.
10 till, okay. All right, so we'll give you a little bit of a break at this point. I'm going to go ahead and mute myself, and we will reconvene in just a bit.
Hey, Christina, I think we're ready to go ahead and resume whenever you're ready.
Okay, and that's great, thank you. I did see an indication there might have been a question. So Sheila, did you see that question possibly come through?
Sure. I have a question that says, patient stories are very encouraging. in your experience, have the videos helped to motivate other patients who've been on the fence about transplant?
Great question. Absolutely. We have found that who better to tell their stories than people who have walked the walk and talked the talk. And we find that all these vignettes, and we cover a great deal of content in these videos, as you will see, talk about both the pros and the cons to transplant. And it really provides a very balanced picture of what transplant and living donation looks like through the eyes and ears of patients, living donors, loved ones who have been through it. So that is all by design, that we use live, real people who've gone through the process. So yes, very motivational. That's our hope anyway. Okay, with that, keep the questions coming too. We certainly have time in this presentation built in to answer any questions. There's no silly questions, so please feel free to make sure we get your questions answered. I'm going to introduce you to the second component of the Explore Transplant program, and this is mostly about what you need to know about being a recipient of a transplant. So this is the recipient side of things, and in the meeting 3, we'll look at the living donor side of things. But specifically, this is really talks about risks, benefits to being a kidney recipient. And we're going to see vignettes of people that have gone through the process. Again, positive experiences and negative experiences, because transplant is hard and doesn't always work, and it's not always the right decision for every one person. So we want to make sure that as we introduce the idea of being a potential recipient, you get a good portrayal of what that could look like for you. So without further ado, we're going to go ahead and meet Amy again, and Christine Lee, who is a transplant coordinator, who will be talking about the recipient side of kidney transplant. Okay. Can you see me? There I am. Okay, I'm back. Sorry. Do we have any questions come through?
We do have one.
Okay, go for it.
Okay. The questioner asked, I have had patients tell me that the transplant centers have told them they will have to fundraise so much money before they will activate them on the list. What expenses are the patients typically fundraising for?
So it sounds like that particular individual that is pursuing transplant is underinsured. That's my guess. That's likely what's going on. And whether they have no insurance or underinsured, transplant is very expensive. And they would be fundraising for whatever out-of-pocket costs are not covered from the insurance. So depending on what their situation is, there could be huge out-of-pocket costs, partial coverage of certain things. It's really hard to say what that particular individual's financial situation is or their financial risk, but clearly the financial counselor at the transplant center did a full evaluation of that patient's financial situation to set them up for success on the front end should that patient be able to do the fundraising for those out-of-pocket costs. Could be cost of medications afterwards, but for whatever reason, that patient is underinsured, and so it's whatever is left over that's no longer covered. And I know that's a vague answer, but that seems to me what's going on with that particular patient situation. And that's one of the risks we're going to talk about now to kidney transplant is that financial risk. It's so important to get a financial assessment prior to transplant or pursuit of transplant, which every individual who goes forward to look into transplant will get, to meet with a financial counselor ahead of time to make sure that look at their insurance coverage, just as we saw in the video. They alluded to that particular patient in the video was going to have out-of-pocket costs, so there needs to be a plan in place as to how to handle those out-of-pocket costs, and even what happens after 3 years if someone has Medicare and loses their Medicare coverage, and we're going to go into that next, so stay tuned. Anything else come up, Sheila?
Not so far.
Okay, so let's just take a look into this component, what you need to know about kidney transplant. Again, you're going to get a copy of this, a hard copy of this material. These are just some screenshots of some of the pages. We're not going to go into everything at length, but just as we saw in the video, this particular brochure compares transplant versus being on dialysis. It introduces the types of dialysis. Again, doesn't assume that everyone who picks up this material already knows what dialysis options are out there. So we did capture some of that information. We also wanted to, again, talk about how successful kidneys are. We've covered this in my slide deck already, so it's mimicking that. We talk about age, huge barrier for many of our patients. They rule themselves out because they think that they're too old or too sick. So we do discuss age. And by the way, age criteria and weight criteria vary from transplant center to transplant center. So if you're thinking about asking me what the age cutoff is, don't, because it really does vary. And the transplant center each has their own guidelines for these two specific things, weight and age. So it's very important to consult with the transplant centers themselves because of the variability in both of those two things. But the most important thing to know is that let's not decide not to get a transplant because you think you're too old when you really aren't sure unless you've been told by the transplant center. What would your life be like? Could you live longer if you were to get a transplant versus dialysis? That's covered here. The types of transplants, which we've covered already earlier. How long does the process take to get a transplant? And that varies in different areas. I'm talking to most people right now in the Midwest. We're more fortunate being in the Midwest. Our wait time's a little bit shorter. on average 3 to 5 years. But if you go to East Coast or West Coast, I can tell you that that wait easily doubles. So something to think about. And then how long on average do transplants usually last for a deceased donor versus a living donor transplant? I gave the stats earlier. We talk about how the waiting list works in more detail. And we also talk about the KDPI. I'm not going to go into that too in depth right now, but it's basically how recipients are matched with deceased donor transplants. And there's a process in place that explains that. There are ways to get a kidney faster. I don't have a copy of that particular screenshot within this brochure, but I do want to emphasize that because we're dealing with a wait list of 3 to 5 years, if you would consider getting a transplant from an increased risk kidney, that would increase your chances of getting a kidney sooner. What an increased risk kidney is a deceased donor kidney that came from someone who had died whose health history is more unknown. They could be young, they could have died unexpectedly, say in a car accident, and they don't have much family information or any family coming forward to say what's going on with that particular person's health history. There is adequate, very adequate examination and testing done of that kidney. So it's very rare that that particular increased risk kidney would have something wrong with it, such as a disease of some kind due to the rigorous testing. But I'm just throwing that out there because I think the Transplant Center may talk to you about increasing your chances of getting a kidney faster should you consider one of these increased risk kidneys. And we'll talk a little bit more about that when I have that in my slide deck coming up. Again, more things covered here is what it's like to go through evaluation, what are the tests, what is the surgery and recovery like, and again, it goes in much more detail. This brochure is probably about 12, 14 pages long. We're not going to go over all of it, but just to give you a snapshot of what types of things are covered in this particular brochure. So with that, Casey, I'm going to cue you up for another Q&A.
All right. Our next question is, nationally, how long are patients usually on the waiting list for a kidney from someone who has died? Is it A, less than a year, B, 1 to 2 years, C, 3 to 5 years, or D, more than 5 years? And at this time, you can go ahead and enter your answers into chat. Looks like we've got about an equal number of C's and D's.
Okay. All right. Well, I respectfully want to say you're sort of both right. Nationally, it's more closer to 3 to 5 years. But as I just mentioned, if you go on the coasts, that wait time doubles. So again, it really depends upon where you live. And again, I'm emphasizing the fact that we're fortunate more here in the Midwest. So onward, another one, Casey.
All right, the next one is a kidney patient with blood type O has the shortest wait for a deceased donor transplant. Is that A, true, or B, false? Well, we've got one, it looks like we've got 2 B's. Most people are saying B.
Okay. Yep. And we'll go into a little bit more into matching, but I don't think that was actually covered in the video about the blood type O's, but we'll cover a slide on this in the near future. So the key messaging here, I think that was conveyed pretty well in the video, and something that we like to remind everyone all the time is if you're at all interested in kidney transplant, not to wait. I showed you statistics earlier that revealed what happens to folks who stay on dialysis, and over the course of 5 years, what starts to happen is they develop comorbidities, they develop many issues, cardiac issues, among others, and just as a result of how hard dialysis is on the body. And you equate that with the waiting list time as well. So it's really important that if you're at all interested in learning about transplant, to go and talk to the transplant center and not to wait, especially given the wait list that we're all up against. And it's only the transplant center is really the only one that can tell you whether or not you are a transplant candidate. Your dialysis providers may coach you on whether or not you are a transplant referral candidate, but truly until you are evaluated by the transplant center, you in fact will not know for certain if you are a transplant candidate. So I just want to make the distinction between the two of those things. All right, Casey.
Before I ask this question, Christina, we did have another question come through.
Okay.
Someone asked, when and how will they know if the donor's kidney is a match for the recipient?
So once you've gone through evaluation and you're put on the wait list, the dialysis centers will be drawing your blood on a monthly basis. And it's that blood draw, the HLA, that gets sent to the transplant center and is put on record so that when the testing is done on a potential deceased donor kidney that comes in, that is when they evaluate the matching process. So they'll know ahead of time who's going to be a match for you. You just won't know when that deceased donor kidney becomes available.
Christina, we have one more question that's come in.
Okay.
The questioner says, how many miles from an evaluation center must you live in order to use a facility?
How many miles? So I'm guessing if you live further away, the only thing I can tell you, and this is a barrier for many people, is distance. So long as you can get to the transplant center within a 12-hour period. So I've had patients that actually, and we'll go into this too, multi-list. So so long as you can get to the transplant center within that window of time that they determine you need to get to, and I'm going to say within 12 hours, that is the only caveat to that. But you have to have transportation, readily available transportation to get to that transplant center. The transplant center they'll specify more of what that window will look like for you. It could be tighter, it could be a little bit more generous, but so long as you can get there, you could live, 3 or 4 hours away and take a plane. I mean, what works for Steve Jobs. So it's all about resources.
Excellent. Thank you, Christina.
Anything else come through?
Not so far.
Okay. Casey?
Okay. Our next question is, on average, how many years is a kidney transplant from a deceased donor expected to last? Is it A, 5 to 10 years, B, 10 to 15 years, C, 15 to 20 years, or D, until the recipient dies?
Come on, everybody. We covered this.
So far, we've got a B, a C, let's see here, and a couple of A's.
Okay. All right. Well, let's reveal the truth. The B's have it. All right. On to the next one. Casey?
Yeah, okay. What is the chance that a kidney recipient or living donor will die as a result of surgery? Is it A, less than 1%? Is it B, 1 to 3%? C, 3 to 5%? D, 5 to 10%? Or E, greater than 10%? It looks like we're getting about an equal amount of A's and B's,
Okay.
and a C.
All right. A's have it. So basically, 3 in 10,000. So the risk is very, very low, and it's actually similar to the risk of any major surgery, but it's still a risk, and we need to talk about those medical risks associated with being a recipient. So problems of developing issues because of surgery is less than 5%, and the risk of death is less than 1. But again, it's one of those things that we have to be aware of, that it does happen. Rare, but happens. And just like we talk about the positives to transplant, we also have to talk about those risks to transplant. We also know within the first year, 10% of patients will have an acute rejection episode, which means that there could be a possibility without the function of that kidney working, call that rejection. When it's not working properly, it doesn't mean you're going to lose that kidney function. And in 4 to 8% of those cases, there is loss of that kidney function. But many times when acute rejection happens, and there'll be symptoms associated with that your coordinators will make sure you are aware of, some of those things, sometimes those rejection episodes can be stopped and treated. So that's why it's so important to stay in contact with your coordinator after your transplant to share those signs and symptoms of anything that might be going on with your transplanted kidney. And as I mentioned before, there is a possibility of a deceased donor kidney, especially if it was an increased risk kidney when you don't know where that kidney came from with a questionable health history. There's a slight possibility that donated kidney might have a transmitted disease that was not picked up from the testing that is done prior to transplant. So like I said, it's rare, but it could happen. Possible side effects of anti-rejection medications. See these less and less, but they still exist. As we saw in the video, the gentleman named Barry, who was talking about his skin cancer, you might have noticed in his ear, he had a nick out of his ear. Individuals that are taking these medications are at a higher risk of developing skin cancer. It's the most common form of cancer following transplant because of immunosuppression. And so we highly advise, the Transplant Center highly advises that you see a dermatologist every year ongoingly as a result of this, something we should probably all be doing anyway. Other side effects could include high blood pressure, high blood sugars, possibility of leading to diabetes or higher cholesterol. Other things such as hair growth, weight gain, infections, nausea, headaches, and tremors. So in many cases, medications can be changed if you have some adverse reactions or were not adapting to your medications very well. So there are different types of medications available. So talk to your transplant coordinator to see if there's alternative medications that maybe don't have the same sort of side effects. There is a social and emotional type of risk as well. We call this myopsychosocial. But oftentimes patients, once they get transplanted, unexpectedly feel certain ways that they didn't think that they would feel ahead of time, such as being overwhelmed by the idea of taking care of somebody else's kidney. The guilt may be associated with taking a kidney from someone who has died. Angry or upset if that transplanted kidney didn't work right away. Individuals are often very shocked if that kidney doesn't work right away and they require dialysis, which is not unusual, that kidney doesn't kick into gear as soon as it's working, as soon as it's placed. And sometimes recipients have to undergo some dialysis treatments to get that kidney going. Doesn't happen all that much, but it's not unusual should that happen. And also the worry about future care of that transplant, especially when it comes to the cost of medications. There's also, as we're talking about the financial risks, there's out-of-pocket costs associated with transplant, things that the insurance companies may not cover and typically don't cover, such as if you had to travel to get to the transplant center, lost wages from being out of work that's not covered by your benefits, child care, are some of the things that you need to think about ahead of time with the financial counselor at the transplant center so they can help you plan for these unexpected expenses. Okay. We're going to have another Q&A, Casey.
All right, so after surgery, how long does it take before donors and recipients can return to their normal activities? Is it A, 1 month or less, B, 3 months, C, 6 months, or D, 1 year? Okay, it looks like so far we've got a couple of B's and an A.
Okay. Well, the A's have it. And I do want to throw in a little caveat to this. In the video, we heard from someone, well, we'll actually hear from her next. Typically, it's 1 month or less, but I do want to say that it does depend upon the kind of work that the recipient is in. Certainly, if it's someone who does heavy lifting, labor work, a little bit more rigorous types of work, their recovery may be a little bit longer, and if there's complications. So 1 month or less is generally true. I think some transplant centers are more comfortable with 4 to 6 weeks, but just knowing that most recipients are back on their feet within a month, with the exception of any complications. All right, one more.
All right, our next question is, after a transplant, how long does Medicare pay for transplant medicines? Is it A, 1 year, B, 3 years, C, 10 years, or D, for the rest of the recipient's life? All right, it looks like we have a couple of D's and a couple of B's.
Somebody's out there smart about it.
And somebody made the comment, depends on what their diagnosis for disability was for.
That's right. Thank you, Alice. Okay, and we're going to cover that, but that is very true. So the answer is 3 years. Now, there's legislation right now, there's a huge push for changing this, and it's been ongoing for a very long time that we've been fighting up against this 3-year policy that you're under the age of 65, and the only reason that you are receiving disability is because of your end-stage renal disease and being on dialysis, then you will lose your Medicare coverage after 3 years as it currently stands. Should you have a different qualifying disability other than or in addition to end-stage renal disease, you may be eligible to continue to to maintain your Medicare coverage. But if most of our patients out there are under the age of 65 and have Medicare due to being on dialysis and end-stage renal disease, again, that is one of the biggest financial threats to getting a transplant, is what are your plans in 3 years should you lose that Medicare coverage? And that's basically what this slide says. At age 65 or older, you will be able to maintain your Medicare coverage based on age. However, if under that age, there is that big potential risk of not having insurance in the future, and that is especially important as you think about the high cost of medications. Now, with the Affordable Care Act, right now, our patients seem to be covered, but there's so much uncertainty about future coverage that it's really something that needs to be worked through with the financial counselor ahead of time, and that is what their role is. What do you plan on doing in 3 years? Going back to work, get employee group health coverage. I mean, there's options, not always options for every one of our patients, but things that have to be thought through on the front end. So knowing that, again, that's one of the big financial risks of transplant. And given that there's financial risks, again, I can't stress it enough, the importance of talking to the Transplant Center about your health and financial well-being. They will help you make a plan and help you work through what some of those things are that you need to be aware of and need to plan ahead for. It doesn't hurt anyone to go into the Transplant Center to learn, to ask your questions. They're going to want to interview you as much as you should want to interview them. No Transplant Center is the same. So you might have a good experience at one and not the other. There's nothing wrong with going from one transplant center to another transplant center to find the right fit for you. If you're turned down at one transplant center, the criteria at another transplant center might be very different. So I would want to encourage you to look at other options, other centers. If you're interested in pursuing transplant, learn about your out-of-pocket coverage. If you talk to a transplant center and there may be some centers that are more in network with your benefits versus out of network. Your copays may be different just depending on what your individual coverage is. No two coverages seem to be alike. So getting that financial assessment is very, very important. And one thing I can't stress enough is we want to make sure that a transplant is going to help you medically and not harm you financially. And that's a big piece of this program as well. So with that, I'm going to open it up to any questions.
Christina, we have a couple in chat. Casey, if you will you look in the Q&A box while I'm going through the chat? So, Christina, this one may be something that would really be best answered by the HLA lab, but the question is, would I be a match for my mother? I am blood type O positive and hers is A.
So I do have a slide coming up about matching. And
excellent.
That is, that's going to be helpful in knowing of what blood types tend to match. But a lot of things go into matching now. And I don't want that slide that's coming up to be the absolute deal maker or deal breaker. These are general guidelines about matching, but there's more things that go into it than just a slide about blood types too. So, and other things you can do if you're not a match. What we refer to as incompatible and compatible, and we'll talk about that coming up. So stay tuned.
Excellent. Next question. Do patients tend to stay on prednisone for a long time after transplant, and can this lead to breakdown in bone health over time?
So I can tell you that typically, yes. There are certain medications you will never get off of. And again, the protocols at every transplant center is different, but taking the steroids are something that tends to be more lifelong than not. But there's weaning, and that's the good news. As far as bone health, I can't answer to that. I would defer to the transplant center about that.
Okay, I think we're caught up right now.
Okay, so with that, we're a little bit ahead of schedule, but I do want to be conscious of everybody's time, and why don't we go ahead and take another short break, and then we've got 2 more segments left of this presentation. We may end a little early, which is great, but I want to make sure that we get everything covered. So let's go ahead, Casey, and take what, you think, a 10, 15-minute break, whatever you're comfortable with.
Yeah, we can do another 10 if that works for you. So maybe just have everybody come back about 10 till maybe.
Okay. So 2:50.
Yeah, we'll say 2:50.
Perfect.
Christina, I think we're ready whenever you are.
I'm ready.
All right.
Okay. So just as we explored what it's like to be a recipient, this next segment is all about what it's like to be a living donor. So similar to the previous videos, we're going to meet more individuals who are going to share their stories about their living donation experience, whether they were a recipient of a living donor kidney or a living donor themselves, and their family members and friends. So we're going to have another video. Okay. So let's go ahead and take a look at that Meeting 3 brochure, what you need to know about living donation. And you'll notice it looks very similar to the brochure we just looked at earlier with recipients. Again, it goes through all of the risks and benefit information, most of which we heard in the video. It compares deceased to living donor transplants side by side. We also take a look at who can be a living donor, what tests do living donors have to take, how long does the evaluation process take, goes into all the many risks. Again, this is just a screenshot of some of the different risks that are covered. But again, just like any other surgery, there are risks. Medical, financial, and psychosocial risks are all covered within this video segment and within the brochures themselves. Moving on, so just like there's risks to transplant and living donation, there's also risks to staying on dialysis, as we've covered before. And I think it's good to take a look at those pros and cons to each, because at the end of the day, it's you who are going to have to decide whether or not staying on dialysis is the right decision by weighing those pros and cons versus the pros and cons when it comes to deceased donor transplant and living donor transplant. So all of those things really need to be thought through and for you to decide what direction you want to go with. There's no one right answer for anyone, only you can decide. The good thing about having the option of living donation, and again, that's not always an option for many people, but if that is an option for you, what living donation makes possible is the opportunity for more people to get transplants, and that better matching kidneys become available for individuals that have the opportunity to participate in living donation. So with that, let's see how well you've been paying attention. Casey, you want to go ahead and cue up the next question?
Sure. How many years on average is a living donor kidney transplant expected to last? Is it A, 5 to 10 years, B, 10 to 15 years, C, 15 to 20 years, or D, until the recipient dies? Looks like we have someone said C. Give y'all just another few seconds to enter your answers. So far, everyone has said C.
Okay, well, the C's have it. So it looks like people are paying attention. That makes me happy. So yes, 15, 20 years on average. Now, again, we're just talking averages. Many of them last more than that, but as you compare that to deceased donation, you can see that those with living donor transplants, they do last longer. They do happen faster, and it can be less than a year in which someone can receive a living donor transplant, as opposed to waiting on the waiting list for a deceased donor transplant, which we know is 3 to 5 years in this country. So that's one of the benefits of living donation. They last longer and they can happen more quickly, which reduces your time on dialysis, and which is a good thing because that reduces the possibility of developing other health issues. They do last longer, like I mentioned, and the thing about living donation is that you can schedule your living donor transplant surgery at a time that works out best for both you and your donor, as opposed to waiting until the middle of the night when you get that call that a deceased donor kidney becomes available. There's less time to plan with that type of transplant. So just, again, something to think about, that you can plan ahead when you're most healthy and your donor's most healthy and can work around other barriers. Okay, so another question. Casey?
All right, this next one is a true or false. After donating a kidney, living donors have a risk of high blood pressure in the future. Is that A, true, or is it B, false? Looks like everyone is saying that it's A so far. It's true.
Yep, and that is true. There is a higher risk of developing high blood pressure, and typically it's managed through medications. Again, it's rare, but could happen, and it's a risk that potential donors need to be aware of ahead of time. Other risks also include, similar to those that happen with the recipient, the scars, hernia, blood clots, pain, fatigue, gestational hypertension or preeclampsia. We've seen that on the rise with women who were living donors and later became pregnant. Risk of death, same as the risk of death for recipients, 1% or 3 out of 10,000. And if a donor had pre-existing high blood pressure, they may need to control their blood pressure, might have a chance of developing end-stage renal disease in the future. Hopefully that doesn't happen, but because that is a potential risk that living donors might go on to have an increase in developing high blood pressure, there also is a possibility of them losing the remaining kidney function, which is actually one of the biggest fears that exist out there. What if I lose my kidney in the future after I donate? And I can answer that. So what happens is, first of all, that is rare. Our living donors are actually healthier than the general population. So when you think about it, that's a pretty unique subset of people. Because of how rigorous the evaluation is for those potential living donors, they are generally healthier. However, there has been some instances where patients that living donors did donate their kidney and did lose the remaining kidney function. In those cases, what happens is that they will be prioritized at the top of the waiting list. And that way they spend less time on dialysis, and that's a lifelong thing. So long as that living donor who loses the remaining kidney function is healthy enough to become a kidney recipient themselves, they would be given priority. So that is one benefit of being a living donor, that you do have those safeguards in place, which is relieving to many people. And also living donors really do need to take care of their own health, have their blood pressures checked every year. Social emotional risks to living donors. There are some that living donors unexpectedly do feel, and those include sometimes feeling pressured to donate by a family member or friend, and that could cause definitely some conflict within certain family dynamics. What if a living donor donated to a loved one and they didn't take care of that recipient, didn't take care of that kidney? That's a potential issue that they didn't anticipate happening, and the loss of that potential kidney function after donating that kidney, feeling upset that that gift gets rejected for some other reason. And again, the threat that changes the relationship with their potential recipient is sometimes at risk. But there are certain protections for living donors, and living donors are evaluated by their own health team. So we saw in the video Natasha, who is an independent living donor advocate, which means that every transplant center has a person on the team who is the independent living donor advocate that only looks out for that potential living donor. They have absolutely nothing to do with that potential recipient. And it's that living donor advocate that makes sure that that living donor is donating for all the right reasons, making sure that the potential living donor has what they need to be able to donate with the correct finances, insurance coverage, everything in place, so that living donor is donating for all of the right reasons and to minimize any potential risk that potential living donor could be subject to. And that is their primary priority on that team, is for that LDA, living donor advocate, is to make sure that that donor is doing the right thing based on all the criteria by that transplant center. And with that, I'm going to have Casey go ahead and queue up the next question.
All right. The first one is, can a donor back out on the day of the transplant? Is it A, no, once a donor matches, he or she has to donate a kidney? Or is it B, yes, donors can stop the transplant on the day of the surgery? And it looks like so far everyone is saying B, that yes, they can.
And that is correct. Even as they're being wheeled into the operating room, they absolutely have to be a willing volunteer. Okay, next one.
All right, the next one is, what cost must the living donor's medical insurance cover? Is it A, donation evaluation test, B, donation surgery costs, C, both of these, or D, none of these? And we've got a D and a C.
Okay. Well, another D. So it's none of these. Living donor costs are covered by the recipient's insurance and or Medicare. There are a few exceptions to that, and we'll go into that. But by and large, that living donor should have very little medical expenses, aside from the things that we're going to cover next. But again, part of that living donor advocate's role is to make sure that that living donor's coverage is looked at fully, so that if there are any out-of-pocket costs, those things are known about ahead of time. Those potential costs are similar to the recipients. Out-of-pocket costs such as housing, childcare costs, lost wages, lifelong medical problems down the road that are not related to the transplant would not be covered. There could be a few other things, loss of income, employment, childcare, those types of things could come about. And there are more programs now, I'm happy to see, that are becoming available to help protect living donors in many of these areas that weren't available before. And at the end of this presentation, we'll talk about those resources. So what's exciting is to know that there has been a lot more resources coming about to help protect the financial well-being of living donors within certain programs. And that's a huge improvement based on a couple of years ago. Here's a slide. Now that I say that I realize it's in the slide deck, I'm going to move it up. But here's the slide I was referring to earlier about matching. And the tissue type HLA matching is a blood test that can show the tissue or the HLA type of the donor and recipient at the level of the HLA antibodies. Again, this is all pretty highbrow. And there's also cross-matching that takes place. So typically, this is with the recipient with the blood type O can only get a kidney from a donor with blood type O. That's why that waiting list is longer for them versus, the other blood types are a little bit more generous. And I don't go into positives and negatives, so that's going to be up to the transplant center to explain those. But generally, this is the rule of thumb of what happens. Now, back to the person who said, will I match your loved one? Well, in the event that you don't, but you still wish to be a living donor, what's really exciting now, and these programs are growing, is now you can do participate in paired donation. And in this particular instance, we have a swap. So we have a donor who wants to give to their recipient, but they don't match. So a sister wants to give to her brother, but they don't match. And a sister wants to give to her brother, they don't match. What happens is they end up doing a swap. So you're kind of just swapping with another couple at that transplant center. And that has been very successful. What other advances that are happening are donor chains. And oftentimes, the donor chains start with a non-directed donor, so a donor that wants to give a kidney out of the generosity of their hearts to someone they don't even know. And that living donor starts off this ripple effect or this chain, which is very exciting, because then what happens when you have all these other recipients and donors that don't match end up being in this really long chain and kind of pay it forward to the next person. And at the end of the day, there could be as many as 35 patients getting transplanted, which is so far, I believe, the record. So these types of advances are really giving an opportunity for donors who don't have a match but do have a willing living donor to actually still get a living donor transplant. So, and sometimes, in many cases, when you participate in one of these donor change or swaps, you could end up getting a living donor transplant even better than from the original living donor that was going to donate to you. So just something to think about. If you're not a match, there are things that your transplant center may be participating in, such as swaps and chains, that could still increase your chances of getting a living donor transplant. So again, call your transplant center if you're interested in this. Different transplant centers participate in different programs. Sometimes it's only within the transplant center themselves that they participate in their own internal chains and swaps. Other transplant centers participate on more of a national level, so their capabilities of increasing their abilities to do living donor transplants are higher because of the fact that they participate in more of these national chains, or if you will, but every transplant center is different. So it's up to you to talk to your transplant center about the programs that they participate in. Call, ask your questions, and they may have other resources out there, financial resources, independent to a national level, maybe more of a regional level, that could help you in some of these other areas where you might need assistance with some financial or practical barriers to transplant. So with that, I am going to open it up to any questions before we do the last segment of the day.
Christina, we have one question, and this kind of runs along the theme of making sure patients are aware of everything related to transplant, not just the pros. And the question is, what do patients have to do when the kidney needs a jump start? So if the kidney doesn't immediately start working after surgery.
Okay, and we talked a little bit about that earlier. That does happen unexpectedly, and if it should happen, that particular recipient would go back on dialysis starting at the transplant center. Sometimes it starts working while still recovering at the transplant center. Other times it may require outpatient dialysis for a period of time, and that's not unusual, and that could happen. But many cases it works, and it does jumpstart that kidney. So should you go into rejection and it never starts, you would find yourself back on waiting or being reevaluated for a transplant rather quickly. Is that it?
That's all I have right now.
Fantastic. Okay, well, let's finish up with the last segment of the day so we stay on time. So again, we're going to watch another video. This last video is going to talk about making a plan. Start thinking about the next best steps that are right for you, the different choices that you have. Again, there's no one right path for you or your loved one. This is all about making that decision about which next step is right for you and how people can support you in taking that step. So with that, I'm going to go ahead and turn on the next video, and which is, okay. And here we go. Okay. So you can see they did a really thorough job in reviewing the deciding what to do about your kidney disease. I have many screenshots of this particular resource, but I feel like the video really gave a good overview of all the different steps a person can take at this particular point in time based on how comfortable they are with that next step. And if staying on dialysis is what an individual decides, that's great. There's actually pointers in here about what to do to make your treatment options better. So some suggestions like that. To thinking about, like what Matt did, imagine your life with a transplant or staying on dialysis or pursuing living donor transplant. And it also goes on to help identify your social support, which is very important, questions to ask your doctor, and just different steps you can take that helps you realize and make a plan of what is best for you. And again, in the interest of time, I'm not going to go through all of these different things, but you will be receiving copies of this decision aid, is what we refer to it, to help you think about what steps are left to take and what you feel comfortable with, and also guides on how to take each one of those steps. So, and again, there's resources in there to help you find transplant centers near you. So if you're not sure which transplant centers are in your area, or if you're not sure which transplant centers might have better outcomes than the other, this resource, this decision aid, has a list of websites that can help you identify that information, as well as help you identify the nearest transplant centers in your area. I want to direct your attention to our own website. The reason why this has relevance is because as part of your patient education packet, which looks like this with everything inside of it, inside this packet there's going to be a label that's going to provide you with online video access. As I mentioned, this education program is DVD based, but not everyone has DVDs anymore, as we know. And so Network 8 has agreed to provide you with online live streaming to watch the videos. If that helps with you, it's unlimited. And the way to access that would be, and we'll provide instructions to this, would be to go to our website, exploretransplant.org, and you're going to see it says for providers, but patients could have access to this as well. We'll have access to this as well. There'll be a drop-down menu to click on the education, and then once you click on to view education, you'll use this login and password to log into the option to view the videos online at your leisure. Again, the videos are not downloadable, and that's on purpose. So you do have to have live Wi-Fi to be able to watch the videos and as you care to. And again, you can watch it as many times as you want. There's no limit to this access. And again, this information will be provided to you on the inside of each of the patient education folders. So don't feel like you have to remember it now, as well as instructions. You will also be receiving, if you're interested, a copy of our Explore Living Donation Education Program. I'm not going to go over this in detail, other than to say that this takes a much deeper dive into those more serious about the living donation option. This provides resources to potential living donors to help educate them on being a living donor, and also for loved ones who maybe are not a candidate to be a living donor, but ways that they can support you in finding a living donor. So it provides a lot of strategies on how to find a living donor, and what you can do as a potential living donor recipient, and what others can do to support this process. And again, that online access will give you access to the videos for this education component as well. We have just about 15 minutes left-ish. Here's just some contact information for me. There's additional resources that we have. Again, part of our resource list. My Transplant Coach is a mobile, it's a mini web site that you can go into. It's for individuals with renal disease to input some information about yourself. It doesn't collect any information through the website, but it will be, you can, let me see if this works. Let me know, Casey, if this link works. It provides a really good overview of, can you see that?
Yeah, well, it's trying to come up.
Can you hear?
No, I don't think we're going to be able to hear the sound through there.
Okay, no worries. Anyway, this is just a resource that if you decide to go ahead and use it, you input information about yourself, such as just age, race, where you live, if you have diabetes or hypertension, some very basic information, and it will educate you about your treatment options, but also pull up some statistics on people like you who are deciding to stay on dialysis versus give a deceased donor transplant versus a living donor transplant. And it looks into 1 year out and 5 year out and all of your options. And so it is very patient friendly, and I encourage you to take a look at that. Again, that website is mytransplantcoach.org. It's free, and it will pull off reports that you can email to yourself and share with your healthcare teams if you so choose to use this resource. A couple other resources we did at Health Literacy Media. Our organization went ahead and revamped the UNOSTransplantliving.org kidney site, so it's more patient friendly and a lot more provides a lot more extensive information. We've got other living donor projects. All these things can be found online. Again, other resources. I don't mean to speed through these, but I want to give everyone the opportunity to ask some questions at the end of this. And then, let's see, I'm not going to go into that now. Okay. I'm going to open the floor up to questions while we have maybe just about 15 minutes left, if we have any other questions or comments. Anybody left?
Sheila, did you have any? I saw one question that came through, Christina. She asked, do you have any tips for patients or social workers to address non-adherence in dialysis as it relates to eligibility for transplant? They go hand in hand, but it's not always easy for patients to make that connection.
I totally agree, and I saw that question pop up. So, there's, again, I've had patients that were miserable on hemodialysis. He lost his hemodialysis access and was forced to go on PD. Now we were all cringing because he was completely non-adherent to his hemo treatments and was not coping at all with hemo. Had to go on PD because of the access issues. He actually thrived on PD unbeknownst to us, and in turn became eligible for a transplant because of his adherence to PD, which we never would have thought possible. But it does go hand in hand. And I think when you get in the listening of a patient to figure out what is possible with a transplant, there has to be enough of a pro to transplant for that individual to realize that if my adherence gets better, I'm going to get that much closer to getting a transplant. But that's not going to weigh very much in their way of thinking if they don't actually identify it with a pro when it comes to transplant. And I don't think that particular patient has identified a pro big enough with transplant to help them realize that adherence is so necessary. And I don't know if that particular individual has been evaluated by a transplant center or not, or whether or not you've been in contact with that transplant center about lack of adherence for that individual. Oftentimes there's that communication piece. Sometimes there's that lack of communication piece. I don't know how much the transplant center knows. But I would encourage, if that person was interested in transplant, to go forward to transplant, have the transplant center weigh in on that non-adherence. They see you the patient sees you every day. And over time, you lose, I don't want to say you lose your credibility, you lose your weight, if you will. But maybe by having another health entity also piggyback on what you've been coaching your patient about, the importance of adherence. If that information came from the transplant center, listening may be a little bit different for that patient, and it might actually help them fully understand that it's not just the dialysis side that's really emphasizing the adherence, but it's also coming from the transplant side, and you're sort of united in your way of thinking and in your efforts in coaching. So I would encourage actually to, and I say this a lot, and transplant centers like to laugh at me, but make the transplant center the bad guy and let the patient know what has to be done. And, that's all you can do. Then they know what they have to do, and then they have to make that decision for themselves. I know that's a long answer, but I oftentimes make the transplant center the bad guy. And oftentimes they want to be the bad guy and to be able to tell somebody you're not a candidate, and this is why. I would want to know from the transplant center that I was or wasn't a candidate. I wouldn't want to be told at the dialysis center that I can or can't get a transplant, me personally. And that's really the coaching that I give to many folks in the field.
Christina, you make a good point there, because I think sometimes dialysis staff may struggle a little bit about being completely transparent with the transplant center on issues regarding adherence, feeling like they really may mess somebody up when it comes to transplant if they're completely honest. And you make a good point that really is just an important part of the process, is working together and being transparent about issues that could cause a huge issue down the road.
Well, and I think there is a level of, wanting to be honest. If you know that someone's underinsured, are you going to take on that responsibility of telling them, well, you can't get a transplant because you don't have enough insurance? I wouldn't want to take that option away from somebody. And far be it for that to be my reason for, as a dialysis provider, I should not be making that decision for the patient. You're not adherent, so should I not be educating you about this option? You don't have enough insurance, so should I not be educating you and encouraging you to go forward? I stand at a whole different level, at a whole different place. If they're motivated enough to get a transplant, they could be motivated enough to overcome their barriers. So it's our job to make sure that they're making informed treatment choices, look at the pros and the cons, and if they see a big enough pro to transplant, the likelihood of them overcoming these practical barriers goes up, that they can overcome them if they see a good enough reason that they are better off with a transplant. It's just fundamental behavior. And that's why during our actual dialysis provider trainings, we spend so much work working with my colleagues, my dialysis providers, of which like I said, I used to be one of them, the importance of seeing pros and helping patients see pros and addressing their level of readiness. And by the time they see focus on those pros, they will overcome their own barriers if they want it bad enough. Now, it's not to say they're not going to need help from us. They will. But you just never know. And that's why I like to leave it up to the transplant centers to do their job on educating, their job on evaluating, see what's possible for that patient, and then hear it from the horse's mouth, if you will.
That is great. Casey, I am not seeing any questions in the chat or the Q&A at this time.
I actually just saw one come in on Q&A just a minute ago. This question is, I'm 70 years old and have been on dialysis for over 15 years. Am I high risk for a transplant?
Well, congratulations for being on dialysis that long. Here's what the transplant centers are going to tell you. So they transplant 70-year-olds. I can tell you that right now. And they're also going to tell you age is just a number. But what they're going to want to do is look at your chart, look at you with their own eyes and their own ears. And that's the only way you're going to know if you are a transplant candidate, is if you call and ask to be evaluated. If I were you, I wouldn't rely on my dialysis center to do that for me. Be proactive. As they say, the squeaky wheel gets the oil. You have every right to call the transplant center yourself and to ask to be evaluated, and call more than one if you need to, and let them know that you are interested in transplant, you've been on dialysis, for a long time, should you be medically eligible for a transplant, your wait time started 15 years ago, and that's really important. So it is worth finding out. Now, it sounds like you're doing very well on dialysis, and you're making it work, which is fantastic. But if you're interested in this, I would call, ask to be evaluated. They're going to ask for your medical records. They're going to look at your medical records first and do what's called a paper cut, if you will. They're going to look at all of your labs, all of your tests, and might ask for more tests before they might ask you to come in and to be evaluated physically. So, but you got to start by making that call. And I want to encourage you to, when you do make that call, and if they do send you information, which is what they're going to do, they're going to send you a big packet of information to help support you in filling out that paperwork. Should you need that support, if you don't have anybody at home to help you, ask your social worker at your dialysis center. That's what I used to do all the time, and I would hope that they would provide you with the same level of support to help you with that paperwork that needs to be returned to the transplant center.
Thank you, Christina. I think that's it for the questions. I do want to give one last reminder, just in case anybody joined us here towards the end. If you're a patient and you called in using the phone only and you aren't on your computer, please be sure to call your network afterwards just to let us know what your mailing address is, and so we can make sure to get your packets to you. If you're a patient in Alabama, Mississippi, or Tennessee, you're going to want to call Network 8, and that number again is 877-936-9260. And if you are with Network 14, that's Texas, that number is going to be 877-886-4435.
I have one last comment, too. As you're calling to ask for education, that just to let you know, if you want copies of both, everybody will be getting copies of both materials. They also come in Spanish. So if you care to have materials in Spanish, please let them know when you make that call, and we can certainly give you resources in Spanish as well.
And one last thing, we're also going to include in that packet a self-addressed stamped evaluation postcard. So we would appreciate it if you take just a minute, fill that out for us, stick it in the mailbox. We really do value your feedback. And I guess at this time we'll go ahead and wind it down. Christina, thank you for a wonderful presentation today. You shared lots of invaluable information with us.
Happy to do it. This is the first time I've done this via virtual, and I think it worked out really well.
I think it did too. And I want to thank everybody else who joined us on the call today. And at this point, we will go ahead and conclude our webinar. Thanks, everyone.
Thank you so much.
Bye-bye.
Thank you all.
Bye.